Welcome to Revive Pelvic Floor Core Rehab, Episode 1, to revive your pelvic floor health safely and effectively. Episode 1, about core back immersion therapy, so you can strengthen your core safely and effectively if you're postpartum, recently or many years ago, or if you're someone who's having pelvic floor issues and you want to strengthen your core safely and effectively. Episode 1, we're going to use the elastic band. I'll demonstrate in the free 6-part video series on how to utilize different equipment with Pilates, yoga, and physical therapy to really revive your weak and unstable, non-functional pelvic floor. If you want to learn more about core back immersion and how to revive your pelvic floor safely and effectively, you can watch my other episodes where I discuss about my Revive Pelvic Floor Core Rehab. I would love you to add this and this video so that you're gonna immerse yourself about core back immersion therapy. So let's begin the program. We are going to start proper breath work with the elastic band. The elastic band will be around your thighs, and we're gonna slowly roll down. Place your hands behind your thighs, chin tuck as you roll down. First, we're gonna learn proper breath work and pelvic floor engagement. You're gonna place one hand at the small of the back to keep your spine in neutral position. If you have anterior pelvic tilt, then you have overarching. And if you have posterior pelvic tilt, then you're flattening. I want a simple neutral position where you can place your hand at the small of your back, and you can just place it there without touching your hand so much pressure, and you can control that position. That will help prevent any back pain exacerbation, especially if you have back pain, because most postpartum or just taking care of your babies, you're having a lot of back pain as well, one-sided weakness, or you're carrying your baby on one side most of the time. So you have muscle imbalance and tilting on your pelvis. So let's begin engaging. Placing your hand at the small of the back, one hand on your abdomen. I want you to breathe properly as you inhale through your nose. I don't want a lot of sound. The louder the sound, the more you're going to utilize your neck and your trunk, thoracic area, your chest, your rib cage goes up, and then you're going to have neck pain, tightness, and bad posture. I want you to inhale, and then you're going to expand through the lateral shifting of your rib cage. And that's when you're going to see some abdominal rising because you're pushing through the side, and then your organs are being pushed up instead of pushing it down towards your pelvic floor. So inhale, press out, keep that spine in neutral position. Try not to overarch. Keep that spine a little bit neutral position with your head, shoulders touching, and your hips. And then as you exhale, I don't want pushing down towards your pelvic floor. I want that zipping up of squeezing from your lower abs going to your navel. So inhale, open to the side, zip it up. 2 more. Breathe in, breathe out, zip. Last set. Inhale and exhale, zip. The next exercise, we're going to slowly open your knee out to the side. So as you do a hip fall out, you're going to feel some stretch on your hip groin area without twisting your spine, keeping that stable, and the other knee and foot really controlled, stable. If you hold that and you started rolling to the left together with the left knee going out, then you're twisting your spine, you're not really engaging your core, and that's when you're just wasting time. You want to make sure when you exercise, it's a lot of mind-body awareness as you open and exhale, zip it up, really pushing my right foot down to the mat, so I'm really engaging my right hip stability, so my pelvic floor is strengthening on this right side, and I'm opening my left side, opening my hip groin area. My hip adductors are getting lengthened, and my hip abductors and external rotators are engaged. Breathe out, and then inhale, back center. And once you go back to the center, I want you to squeeze your knees and hands together to really engage, contract those muscles. And then you can add some Kegels, which is when you imagine if there's a small size green pea going up from inside of you, going up to your kidneys. If you want to hold your pea. And I'm doing that hand motion to connect. And then we switch to the other side. Opening, inhale, rib cage to the side, and then slowly opening my right knee out to the side, and then zip it up, and then back center. And once I back center, I could squeeze my hands and knees as a visual. Breathe in again, belly rise, opening your rib cage, and zip it up. We have 4 more. Three more to go. Squeeze in the center before switching to the other side. Inhale. Last set. Squeeze my knees together before switching to the other side. And that's it. Now we are going to do butterfly stretch. Butterfly is when you're opening both knees out to the side. As you exhale, zip it up. Inhale, belly rise as you reach that hip opening, and then zip it up before going back to the center. And once you reach that center, you're going to squeeze your knees together as tight as you can. Engage those deep pelvic floor muscles. Inhale, belly rise, exhale, open. Inhale, belly rise, zip it up as I go back center. Breathe in, breathe out as I squeeze, and then inhale, and then open. Inhale, exhale, and then back center. Inhale, exhale, zip it up. Inhale, exhale, open. Last set, breathe in. Breathe out, center. And now we are going to do some bridging. Bridging is one of the best exercises. Bridging is one of the best exercises that engages your glutes and your pelvic floor as you lift. With your feet down on the mat, place your hands on the side as well for support. Breathe in, belly rise, exhale, zip it up, and slowly lift your hips up. And then once you reach the bridge, then you're going to breathe in again. Zip it up, exhale, and slowly roll down, bone to bone down to the mat. Inhale, belly rise, exhale, lift. Inhale, belly rise, exhale, zip it up, and then roll down, bone to bone down to the mat. 2 more. Inhale, belly rise, ribcage opens, and then zip it up as you lift. Exhale, zip it up and roll down. 2 more. Inhale, belly rise, and then zip it up as you lift. Inhale, exhale, roll down, bone to bone down to the mat. Last one, my friends. Inhale, belly rise, and then zip. Inhale, exhale, roll down, breathe out. And the next exercise, we're going to bridge with butterfly, which means we're going to really target your glutes. Inhale, belly rise and lift. Hold that bridge, and then we're going to slowly open your knees out and keep that hip muscles engaged and your pelvic floor with zipping it up, and then center, open, center. 7 more. We're going to feel the burn on your glutes. 5, 4, 3, 2, and 1. And then slowly roll down, bone to bone down to the mat. We are cooling down now from some gentle stretches. Open your knees out to a butterfly stretch. Feet together and hold it there. Take deep breaths. Now reach for your feet in a butterfly position, pulling it towards your chest and hold that position. And then rock side to side. Now grab your big toes with your hands and lift your feet up for a happy baby pose and rock side to side. And that's it. I'm hoping you enjoyed my Revive Pelvic Floor Core Rehab Episode 1. To learn more about core back immersion, tomorrow you're going to learn how to use the foam roller and how to strengthen your core safely and effectively. I'm so excited to show it to you. As I said, watch this other episode so you learn more about my core back immersion and how to revive your pelvic floor muscles safely and effectively. Watch this video for episode 1 on my other 6-part video series, and this is episode 2 on how to do proper breathwork in seated position. Until my next video training, always remember, be safe, be well, and healthy you. Bye!